Back in the middle of October, the U.S. Department of Health and Human Services Secretary Becerra officially renewed the COVID national public health emergency for an additional 90 days. That takes that COVID public health emergency to the middle of January 2023. It is now expected that that public health emergency will once again be renewed in January. This will be the 12th time that it is extended. The renewal is expected because the feds had promised they would give 60 days notice before the public health emergency were to end. So if it were to come to an end in the middle of January 2023, we would have heard about it in the middle of November 2022. And we have passed that date, and we did not get notice from the feds. So we are now working under the assumption that the national COVID public health emergency will once again be renewed in the middle of January for an additional 90 days. States, providers, and patients are counting on that 60 days notice. It gives more time to plan and prepare for changes. The biggest one will be the continuous eligibility of Medicaid. Medicaid will begin unwinding its continuous eligibility in the months following the end of the national COVID public health emergency. But the continuation also allows millions of Americans to still receive free tests, vaccines, and treatment for COVID, something health experts and the Biden administration say could be critical in winter months. It's in winter months that we traditionally see a spike or a surge in COVID cases. The feds also say there is also more work to be done to transition away from the public health emergency. One of the big action steps they are still planning for is the transition of the COVID vaccine to the commercial market. What's next? The public health emergency, like we said, is likely to be renewed in the middle of January 2023 for an additional 90 days, which will take us into April 2023. Now, the feds could end it at any time. They just promised to give 60 days advance notice before that happens. You can read more out of the U.S. Department of Health and Human Services. We link to some resources in the description below.